Hi, my name is Whitney Graham, and we are going to be doing the second palpation video. So first, we are going to start in her back. I'm going to start at the spine of the scapula, and I'm going to move over, and that's where T3 is going to be. And then I'm going to move down the scapula to the inferior angle and move over, and that's where T7 is going to be. For the C6 spinous process, you would start at the occipital bone, which is going to be right up here. And then you move down, and then the C6, D7 is going to be the lowest cervical spinous process. Okay, next I'm going to find L4. So I'm going to go in down here at the dimples, and I'm going to move in towards the middle, and that is going to be L4. And I'm going to turn around like that, and then right in here is going to be the ASIS. Okay, next we're going to do the ischial tuberosity, so turn around, and then right underneath the fold here of the gluteal is going to be the ischial tuberosity. So now she's laying on her back, so I'm going to do the greater trochanter, which I can find that right up in here. I can also move her leg to the side, and I would be able to feel the greater trochanter right up here. And then next, the adductors, I'll have you put your leg like this, and then right in here, I would feel the adductors. Okay, so go ahead and push up on my hand, and then I would see the adductor longus and the gracilis body. Do it one more time. Okay, now I'm going to have her straighten her leg, and I'm going to come up here, and this is where I'm going to find the iliacus on the interior, and then on the posterior side is where I'm going to feel the tensor fasciae lata. In the same position, if I find the ASIS and I move about 2 inches down, and this is where I'm going to find the AIIS, and that's also where the rectus femoris is going to begin. Okay, with your legs straight, go ahead and flex your quads as tight as you can. And then right in the middle is going to be the rectus femoris. Okay, for the gluteus medius, go ahead and lift this leg up. And then if I go to push her leg down, I'm going to feel the gluteus medius right in here. Go ahead and kick your heel into the bed. And then right up here, I'm going to see the hamstrings biceps femoris, and on the other side, I'm going to see the semitendinosus. On the same side, more in the middle, you are also going to be feeling the gracilis tendon in the knee, right under here. With your legs flat, go ahead and flex your quads again as tight as you can. And on the inner side here, you're going to find the vastus medialis. And then down below towards the knee, we're going to see the pes anserin area down here. Okay, so the patella is going to be right here. The patellar tendon is going to run below here. And then the tibial tubercle is going to begin right up here. Coming in on this side of her leg with her knee bent, at the top here, you're going to find the medial femoral condyle, right up in here. Okay, on this side of her leg, on the medial side, in between the joint here, I'm going to come over, and this is where I'm going to find the medial meniscus. And then the gastroc muscle with your leg bent like that, this big muscle right here on the back of her leg is going to be the gastroc. Okay, the plantar fascia is going to be this part of the foot here, and the calcaneus is going to be right here, and then the deltoid ligament is going to be on the inner side right in here. Go ahead and point your toes towards the sky, towards the ceiling. Right in here is going to be the extensor digitorum brevis, and then go ahead and point your toes towards the wall. On this inner side is going to be the posterior tibialis tendon right up in here. The fibularis brevis insertion is going to be on this side of the foot at the base, and then the fibularis longus insertion is going to be on the other side of the foot at the base here. Okay, go ahead and point your toes towards me again. The extensor hallucis longus is going to be right in here, and then go even further as far as you can. The anterior tibialis tendon is going to be right in there. The IP is going to be this joint here. The talus is going to be the big joint right here. And the navicular is going to be on the inner side in here. The cuboid is going to be on this side of her foot, right at the base here. It is the cuboid. And then the anterior talar fibular ligament is also going to be on this side up here, right in there. If I come down here, all the way up into here, this is going to be the first cuneiform.